Hey guys, Tony Maritato here, licensed physical therapist, and I saw a great question in the Total Knee Replacement Support Group for Kind People on Facebook. Somebody asked about the iliotibial band, the IT band, and they wanted to know specifically if it's something that could restrict knee flexion. So is the IT band limiting your ability to bend your knee? Absolutely no, it is not. Like, I could say definitively, no, it is not. That's not the way the anatomy works. So behind me on the screen, you can see a couple images. I'm going to explain a couple of things. So the center image of the one you see behind me, that white fibrous tissue, that is the IT band as illustrated. And as the knee starts to flex, as the knee bends, you can see the lower leg bones, the tibia and the fibula. The fibula is that long skinny one on the side. As the knee starts to bend, that IT band actually slides posterior just a little bit. And if anything, it would assist with knee flexion. It cannot resist knee flexion. Now, it's important that we note the IT band is connective tissue. It's not muscle. So it's not a contractile tissue. It's not something that's really going to like contract, relax like a muscle would. Doesn't really shorten or lengthen like a muscle would. It's insanely strong. Taken out of the body, the IT band can handle loads that are just unimaginable without damage, without lengthening or shortening or doing anything. So, you can really think of the IT band as just a thick fibrous rope that's running down the side of your leg. It comes down and attaches kind of below the line of the knee joint itself on the tibia. But let me show you guys another image here. And so this is the actual human anatomy. Hopefully this doesn't bother anybody looking at it. Those white, fibrous, kind of shiny, horizontal fibers, again, that's the IT band. You can see the knee, the patella, which is the kneecap at the top of the image. You can see that circle, which is Gertie's tubercle. That's the little bump on the outside just below the line of the knee. That's actually where the IT band comes in and those fibers are attached. So again, you can see that the IT band itself will not limit knee flexion. Certainly it's going to, I hear people all the time talk about, I have a tight IT band, I have an inflamed IT band. There can be some inflammation there. But I don't want you to think that it's something that routinely is going to limit your ability to flex the knee. So if you're feeling or experiencing pain associated with that area, I find that, at least in my physical therapy practice, the best way to treat it is with a little soft tissue massage, nothing super aggressive. Yes, there are people who love doing the foam roll. Yes, there are people who love like really aggressive deep tissue work. But for the people who don't, a simple rolling pin, some light massage, all we're really trying to do is desensitize the tissue a little bit. We're trying to improve circulation, maybe facilitate some fluid exchange. Most of the time, at least in my belief, my philosophy is the fibers of the IT band themselves are not the problem. Yes, you feel pain in that area, but it could either be a referred pain or it's a pain associated with other tissue in the area. It's not actually the fibers of the IT band. So I hope that gave you a little bit of useful information. If you have more questions, please post them in the Facebook group or post them here below this video in the comments. I'll catch you guys on the next video.